Welcome to the AA Podcast, our little corner of the web where we are not afraid to discuss tough questions like,
when did nutrition, health, movement, and stress management become alternative medicine?
Where we embrace challenges in all aspects of life to become healthier and stronger versions of ourselves.
And where food and movement are the best kinds of medicine, and cooking meals at home is a revolutionary act.
Hello, and welcome back to another episode of the AA Podcast. This is Ashley Olson.
And I'm Andrea Crane.
We are continuing our two-part series on hair loss in women and the root causes. Dun dun
Ha ha
dun.
ha ha.
Pun intended.
We
So
are
last
funny.
episode we talked about why it might happen, and then this episode is all about what you can do. So we're not leaving you hanging by the roots.
Hanging by your poor little hairs left, on your head. Hey, you know what? Okay, let's do our Bible verses, but then I have a question before we dive in.
All right.
So,
Well,
all right.
before we do dive in, mine is
Mm-hmm.
coming from Psalms 19:7, and it says, "The instruction of the Lord is perfect, renewing one's life. The testimony of the Lord is trustworthy, making the inexperienced wise." Oh my gosh, I
Oh,
love that.
isn't that good? So mine is Psalm 27. This is my psalm. So for any of you trying to co-opt
Nobody
my
else can
psalm,
claim
this
it.
one belongs to me. There are lots of them for you to pick from. So this is 27, 13, and 14. I am certain that I will see the Lord's goodness in the land of the living. Wait for the Lord, be strong and courageous. Wait for the Lord. So
So
that is for
good.
me. That's for me personally because I am waiting right now.
Yes, so
Trying to
much
be
waiting.
patient. Yes.
Yes.
So Ashley, my question for you is, did I wanted to make double dog positive that we talked about traction alopecia. Does that ring a bell with you? Because I don't think we got to that last time, did we?
I believe so. Remind me again of what that is.
That's when where you wear the high ponies. I wear a lot of high ponies, and
Yes.
that can lead to some traction alopecia. So anytime you pull your hair tight for a like a hairstyle that's kind of swept away from your face,
Oh, yes.
anything that pulls on your hair for hours and hours and hours at a time. And for those of us, namely me, that lives in a ponytail or a bun, or just getting hair off your face all summer, those hairstyles, you want to have them as loose as you can but still do the job.
Okay.
um because that can lead to some damage to the follicle, which it will pop that hair out and may never recover. So also over processing, obviously, right? Like the
Yeah.
blonding
Especially for
that we all
blondes.
do.
Yeah.
Yep. Frequent heat styling, that's a problem. So if you can go a few days um on your hair. Also, I am a huge, well, okay, dang it. All right. We'll talk about this in solutions. We'll talk about this in solutions. But
Okay. Okay.
also, did we talk about drugs? Because I think we did. I'm pretty sure we did.
Yeah. I'm pretty
Yeah, I think we
yeah.
did.
Yeah. I think we talked yeah, because we
Okay.
talked about the GLP ones,
Okay.
and the
Okay.
nutrient deficiencies that
Mhm.
causes, obviously, chemotherapy. Yeah, we talked about those.
Right.
Yes.
Okay. Okay, cool. All right. So now I want to get started on solutions. And so the first thing that I wanted to bring up, and you guys, we are working on something kind of exciting for you, which you will hear at the end of this episode. We're going to record it separately, but we're working on an exciting new relationship. And we are trying to get you a deal.
Yes.
But we are, I want to tell you about collagen peptides. Ashley and I have been talking about these for years and years and years and years. I've probably been using collagen for close to 15 years. Ashley, you've been using it forever too. And
Probably ever since, I mean, pretty soon after I started work, that I had met you.
mhm,
Um, so
yeah.
almost 10 years.
Yeah. It's yeah, boy, that's crazy. So I I cannot stress this enough. There's something unique about collagen, and we've talked about this before. So go back to a previous episode. Do you remember where we talked about that? I'm just gonna go over it real quickly here. People talk about the fact that collagen is not a complete protein, and they
Hmm.
kind of poo poo it or demonize it or say that it doesn't do all of the things that we say that it does. And I am telling you, I've been saying this for years. Collagen, yes, is it an incomplete protein? Well, yes, technically it is. However, there's something very special about the way that collagen works in the body. It's almost like it gets co opted and transcripted for very specific functions. And those functions are the health and maintenance of skin, hair, nails, and joints.
Hmm.
So,
Yes.
this cannot be overstated. Like it's collagen is helpful for hair growth. It is helpful for nail growth. It is helpful to keep your skin nice and plump, and so that you don't look like you're 80 when you're 50. It helps to keep your joints loose and lubricated. And it's a phenomenal protein to have
Yes.
in your arsenal. So,
And I want to
mhm,
bust another myth because I've had several clients ask me about this recently. Um, does putting collagen in a hot beverage deconstruct it?
denature it? No,
Yeah,
no, you're fine. You are not boiling your collagen. You are putting it in coffee. If you're
yeah,
putting it in it's just not that fragile, right?
yeah.
So if you're putting it in boiling hot water, then I don't know, would you be denaturing that protein? Um, That's a
Because,
good question, and I don't have the exact answer for that, but here's what I know. So to denature a protein, agitation, like shaking, vigorous shaking, can sometimes denature a protein. Also heat can sometimes denature a protein. I honestly like you can't drink coffee hot enough to denature that collagen.
yeah,
So just put a scoop in your coffee and
it's what
call
I
it good.
do. So
Yep.
good.
Yeah. So, collagen, I recommend when somebody's first getting started with collagen, I recommend 3 scoops a day. And that sounds like a crazy amount, but I'm telling you, you want to. You want to do this. You want to do 3 scoops a day, and I'll usually have people do it for 2 months. Then you back off to most days 2 scoops. Okay. So I would say anywhere between like 4 and 6 days a week, make sure that you have 2 scoops. On all days, make sure that you have at least one.
Okay. Yep.
Okay. Yeah, it's a game changer. Now, I also want to talk about protein. Okay. Again, protein. You need protein. Your body will prioritize muscle maintenance and synthesis and enzyme production and cellular housekeeping, protein construction. All of that will be ahead of hair growth and creation. So you want to make sure that your body has lavish amounts of protein so that it can say, okay, we have all of these amino acids in our bank account, plus we've got all of this collagen over here. And so, yes, we are going to go ahead and allow the body to make this luxurious hair. Okay. So, protein, extremely important. We have talked this to death.
Yeah.
Also,
if you
iron.
if you have
Ever met
listened,
us?
yeah, ever met us or
Mm
even listened to one episode, I'm pretty sure a protein is always
hmm. Mm hmm.
mentioned.
Yep. Yeah, we are kind of one trick pony when it comes to protein. So,
Yeah.
also iron, you guys. If you have a very low ferritin, um, in fact, I'll give you a number here. If your ferritin is below 70, and I will just tell you, I don't think that this is true for everyone because my ferritin is frequently below 70. However, I also struggle with autoimmunity. And
Mm.
so with chronic levels of inflammation, people with autoimmunity like myself we're always going to struggle with that. And so my ferritin is suppressed, and I think it's because of that, the chronicity of the inflammatory response. However, I do have a lot of hair, and it's longer than probably ever been in my life. Like, I'm tucking it into my pants. So yeah, there's a lot of hair.
When did you notice your hair starting to really grow like that?
um it's when I started the collagen, that's when I really noticed it. And I used to keep it a lot shorter. It's only been in recent years that I've even allowed it to grow that long, but it will just keep going. And at my age, I don't think it's supposed to be that long. Like usually women will have complaints of my hair won't grow past this certain length.
Mhm.
But I don't actually know how far mine would go, because it's just too much of a pain in the butt when it gets that
Yeah.
long.
Yours
So,
is crazy long.
um, it is crazy long. So, I am a huge believer in protein, and also collagen. And then you also want to make sure. Now, I supplement with vitamin D really, really consistently, again, because of autoimmunity. So, you want to make sure that your vitamin D is, oh, above 50, certainly above 50, and I would say up to about 80 or 90.
Mhm.
Um, zinc, that's another key component. 15 to 30 milligrams of zinc a day is also really helpful. Um, Now, the final thing that I want to talk to you about, on the socials, there is, gosh, what's that stuff called? Nutrafol.
Mhm.
Nutrafol. This
Yep.
stuff is everywhere.
Yep.
Okay, so usually when you see hair and nail formulations that are really expensive, it's just a really expensive biotin.
Mhm.
Okay, so all these capsules they're just a really expensive vehicle to get a crap ton of biotin in your body. Now,
Mhm.
yes, biotin does help, except that it is a lab wrecker. So here's what you need to know. I can't stand it when my patients are on huge amounts of biotin, because if I do hormone labs, if I do thyroid labs, if I do certain labs that tell me details about cardiac function, these this biotin will artificially suppress some values. It will artificially inflate other values, and you have no idea what the real value is. So biotin is problematic. So if you are on biotin and it's helping with your hair growth, which I have no doubt that it is. It definitely
Mhm.
does help. However, you want to make sure that you get off of that before you have any labs drawn, because there are lots and lots that respond to biotin in the
And
body.
before
So,
anybody comes at us about the Nutrifoil, there are a lot of other
uh,
things in the Nutrifoil, but
yes,
they're
yes.
the main things that are helping with the hair growth is the biotin.
Yeah, yeah. So I'm just saying, you don't have to spend that much, but
I know, and that's
whatever.
the thing too, is like most things you don't have to spend a lot of money on.
Mm-hmm.
And a
Yep.
lot of, this is on a rabbit trail, but like most supplements you can get very reasonable.
Mm-hmm.
And a lot of times you don't need as much as you think you need.
Yeah, that's true. That's exactly right. So,
So,
all right, the next thing we'll talk about is stress management, because
mhm,
stress will also make hair jump off your head.
mhm,
Um, and I know that we've talked about this before, but there are adaptogenic herbs that can help with stress response. Now,
mhm.
you cannot supplement your way out of a
Bad lifestyle.
ridiculous lifestyle. Yeah,
Mhm,
you just can't. And so if you are in, oh my goodness, if you have horrendous toxic relationships, if you've got a job that is killing you, if you have um, health issues that are unaddressed and ongoing, no amount of adaptogens in this world are going to help you.
mhm.
You have to go to the root. again, and and you have to deal with
Dun
it.
dun
So,
dun.
dun, dun, dun. but there are some really good adaptogens. Holy basil, tulsi. I love ashwagandha. Unless you have a nightshade sensitivity. I like cortisol manager from oh, for crying out loud. It's little yellow label, cortisol manager. Therapeutic ah therapeutics is in the name. Anyway, we'll come up with that here in a second. But yeah, integrative
Integrative,
therapeutics,
yeah.
right? Yeah,
Yes.
sorry, integrative therapeutics. Yes, they make a really great cortisol manager is what it's called. But rhodiola, there's lots of good adaptogens. Also, you don't really have to spend money on adaptogens. You can do breathing exercises. All right. You can also quit your job and go do
Ah!
something else that makes you a
Yep.
little happier. But yeah, breathing exercises. I love 478 breathing. You guys all know that. And I also really like other forms of vagal stimulation. If you just Google vagal stimulation exercises, lots of things will come up. This is
Yep.
starting to get a lot of traction
Mhm.
in the public consciousness. So yeah, just Google vagal stim and lots of different exercises will come up, from humming to gargling to breathing, lots of different exercises. Now,
These are also
also,
very good for digestive issues too. So if you're
oh yeah,
finding
for
after
sure.
you're eating you have a real upset stomach,
Mhm.
you can do this prior to eating and kind of
Yep.
getting your body in that rest and digest.
That's exactly right. Yes. Great point. That's about
Just
all
a
I
little
had
nugget
on
for you here today.
I That's right. You can also address cortisol imbalances at night if you're wired and tired. But again, you guys, ugh, I I am sometimes hesitant to give a lot of supplement recommendations because, I don't like green pharmacy. I, a handful of pills is a handful of pills. And so I really prefer that we, use the things that we have at our fingertips, like breathing, like lifestyle, like dietary interventions. You have to eat, right? You don't have to take pills,
Hmm.
but you do have to eat. And so if you eat the right things, then that also will help
Hmm.
to curb stress. So now that said, there are some ways to kind of balance cortisol at night, because when cortisol is high, melatonin can't rise. Okay, now melatonin necessarily should rise at night because that's when we're getting sleepy. And so, it melatonin functions as a hormone in the body, and it does lots and lots of different things, to include being a pretty potent antioxidant. It also, my gosh, it's the only agent we know of that increases the tonicity of the lower esophageal sphincter. So this is that ring shaped muscle that where the esophagus meets the stomach. And so if that's not tight, then when you lie down, acid washes back up and you get heartburn and reflux as you're sleeping, and that's no good. And melatonin actually helps to increase the tone of that muscular contraction. So anyway, just a fun little thing about melatonin. But if cortisol is still high at nighttime and hasn't gone down, that suppresses your melatonin. So you can block the response of cortisol with some phosphatidylserine. And
Hmm.
you can take up to about 300 milligrams at night and just kind of see how you go there. But
Go back
also,
to
I
our
would do
sleep
all those.
episode.
Yes, please. So the next thing is going to be like scalp and circulatory support. So uh, these hair follicles, they don't make hair, they don't do their thing without a steady supply of blood. And blood brings oxygen, and blood brings all kinds of other healing components to it. And so you've got to have adequate blood flow. So one thing that you can do is scalp massage, and that will improve blood flow. You can also, so there are some shampoos that contain like rosemary extract, tea tree. those will also improve blood flow to the scalp. They're kind of
Yeah,
vasodilators.
yeah. And I actually noticed a huge difference when I switched over to a product called Divi. Um,
Oh, yeah, talk about that.
Yeah, so a lady that I follow, she's dealt with hair loss for a long time. I
Mm,
think she did a lot of
mhm,
other things, but she was super passionate about scalp health as she learned
mm,
more about her journey. So it's basically
mhm,
the exact same thing. Like, how do you create a better scalp health? So the I
mhm,
use Divi, and I started with their serum, and I noticed a huge difference immediately of my hair growth,
mm,
and
mhm.
quality of hair growth too. And it wasn't breaking off nearly as much. And so
Uh,
it has tea tree oil, all the things that you just listed.
yeah, yeah.
But yeah, it's really good. And now she's come out with a shampoo conditioner too. So,
Uh,
and yeah, and it smells amazing, of course, too. So
yeah.
no promotion here, just something that I actually love.
Yeah, love it. All right. Yeah, I think I'm gonna try some of that too. Um,
I can send
the
you
other
I can send you a thing of the serum because I have a lot.
oh, yeah, that would be amazing.
Yeah.
So the other thing that I wanted to bring up, this is a lot of people are getting into the microneedling of
Mm-hmm.
like of the face, of the scalp microneedling. If you've got a needle that's between about a half a millimeter to 1.5 millimeters, using that once a week can stimulate hair growth. You can also microneedle in certain serums. Now,
Mm.
I would suggest that you try a GHK copper serum. This is a peptide. And so, actually, I don't think we've talked about this one yet. We probably need
No.
to do an episode on GHK copper. But this is a sort of a hair growth. It has a lot of different functions, but people do use it for skin health and for hair growth. And there are some really, really super bougie, fancy face creams that contain GHK copper these days.
Mm.
And so you can get some already created serums that you can then microneedle into your hair. Now, here's the problem with applying things like this for me. As a woman with long hair, microneedling those things in, like, I don't know. I can't sleep in all the goo, right? Like I can't sleep in gooey, messy product. And that's just like, I don't know how long you have to leave that stuff on. I would imagine you just leave it in for an extended period of time, because you certainly don't, it's expensive and you don't want to waste it. But if you've got shorter, maybe a little more manageable hair, that might be a better option for you. But
Okay.
I know people do get some really good results from microneedling. So
All right.
something to look into.
Okay.
Now, along those same lines, you can also, we're doing lots of really cool stuff with PRP. This is platelet rich plasma. So we're doing injections in the face in instead of filler.
Mm-hmm.
People are getting PRP injections, and I
Yep.
think those are probably going. I think we're going to find that those are a lot better in the long run than
Yeah.
this hyaluronic acid based filler. So yeah, you can actually go to facilities like medical aesthetics places, and they'll take your blood, they'll spin it down, they'll get your own plasma, and then they can microneedle it, they can do injections into your scalp. But it's really, really well tolerated because it's your own plasma, right? And
Mm-hmm.
so, you don't get any kind of reaction or inflammatory response to it. Now, these treatments can be fairly expensive, so often those are cost prohibitive,
Mm.
but they are out there. And then there are also some lasers. Now, um, there there are so many different types of aesthetic lasers these days. So I would do a lot of research before you drop big money on this. Um, yeah, and I don't even pretend to know a lot about all of the aesthetics treatments that are available these days, but there are apparently some laser therapies that can increase blood flow and that can increase follicular activity so that you get that hair growth. Now, theoretically, this makes sense to me because there's a lot of really good data on like red light therapy and what it does, right?
Well,
And
my
so,
client literally has a ball cap that's a red light therapy ball
uh,
cap.
okay, so what's her experience? Has she had good experience with it?
Yeah, I don't know. I'd have to ask her as of recent if she's noticed any drastic changes. I think for big one is that she just feels warmer because it's on the hat, and so she just wears it in the morning to warm up.
Okay.
But
Well, you could also put a hot towel on your head and
yeah, but
yeah.
there have been studies on red
Mhm.
light, so it's
Yeah,
not hurting. So
exactly. Exactly. And so, yeah, if you have a lot of disposable income and you want to throw it at some red light or maybe even some blue light therapy, um then by all means and let us know, um there aren't uh, any side effects of significance when it comes to these types of red light or blue light therapy, so go for it. See if you have the chance or the opportunity to try some of that stuff. I think it's great. Now there are more permanent solutions for for hair loss, and those include things like you know, uh, minor surgical procedures like hair transplantation. And so this is more of a permanent solution where they will strategically take follicles from other places on the head and then put them, again, very strategically place them in the places where you need more hair growth.
yeah,
Um, it is invasive. There is a risk of scarring. There is an infection risk because it's invasive and because you are literally going in for a minor surgical procedure, so that is what I would consider pretty extreme. However, if I were facing something like alopecia, if I were facing something like a complete loss of hair, then yeah, I would probably do what it took, right?
yeah. And I've
um
heard that if you
mhm.
want to do hair transplant, go to Turkey.
Oh, I've heard that too. Yes. That it's much, much, much less expensive over there, and they're extremely well trained. So,
Exactly. Yeah.
there you go. Yeah.
Yep.
Right. For those of you that don't have kids in college, go to Turkey and get your hair transplanted. So, I will be staying stateside because
For multiple
I still
reasons,
have
but
I have a
still.
lot of people on my payroll right now. So, yeah. Let's see. So now I also wanted to talk about hair styling and washing because this
Hmm.
is a big deal. Um, hair there is First of all, let's talk about hair styling. No, I'm sorry, let's talk about hair washing. So Ashley and I, we have a bit of a illustrious history with the whole no poo thing and hair washing and delaying hair washing and hair training, if any of you are familiar
Hmm.
with this. And so yeah, so she had found this gal on Instagram who was doing this hair training. The weird thing is, Ashley, you found her when I was in Colorado with you.
Hmm.
And come to find out, this lady has her salon in all the places of the United States. She happens to be in Nampa, Idaho, which
Yep.
is exactly where I moved. I had never even heard of Nampa before, but yeah, that's where she's based out of. And I have not had the opportunity to meet her yet, but I know that she's here. And she's the reason why I still only wash my hair once a week. How about you?
Yeah, I'm still about once a week, but I'm probably more around once every 4 or 5 days right now.
Okay. Yeah, in some weeks, especially in the summertime, or if you've been doing like honestly like more cardio or you've been sweating more, then I find that it's important to wash a little more frequently. But um yeah, and you guys, there's a sweet spot, okay? So
Hmm.
so this lady, she would go like a month without washing her hair.
Yeah, I
And
don't know
her
if she
hair
does
was
it as much as.
beautiful.
Yeah, I don't know if she does that frequently, but she basically did a test on if she could
Yeah.
go, how many days she could go and
Yeah.
actually look good, not just
Right.
like
Right.
she could actually
Now,
do something with it.
and day 7, I gotta be honest, like, day 7, it's not a good look, for
Oh yeah.
me. So, a week is absolutely the longest that I can go, and I cannot seem to get my hair to go any longer than that. Like, I have to wash it. Um,
Yeah,
but here's the
I
thing.
haven't been able to push it. I think the longest
Mm,
I've ever gone is 10 days, and that was like really pushing it. Cuz
yeah.
I mean, my today
Yeah.
was a hair wash day, so it's fine. But
Mhm.
like tomorrow after and because my hair's so fine, like
Mm,
it
mhm.
just doesn't ever look good.
Mhm. Yeah. No, I get that. So I just want to make sure that I clarify. If you go too long, you will get buildup on your scalp that is, one, it's gross, but
Yep.
two, it is a perfect breeding ground for fungal infections.
Yes.
And you will get a folliculitis or a fungal infection on your
Mhm.
scalp, and that's not good.
No.
So if you go too long, that's not good. But also, if you wash your hair every single day, then you are really overstimulating your oil glands because
Yes.
you're stripping your hair every single day.
Uh-huh.
Your hair wants to create oil to, um, to provide some just moisture to it,
Yeah.
right? Like,
And sometimes what I'll do if I really feel like like I can't go any longer, I'll just get
mm-hmm,
it wet, like kind of
mm-hmm.
do a scalp massage, if you will, but not
Mhm.
with shampoo. And then I will
Mm.
just condition my ends.
Okay. Okay.
And that gives me a few more days. But
Huh, okay. I've tried that and I just cannot get past, like, do you dry it after that or do you just let it air dry?
oh, I always blow dry my hair.
You blow dry it? Okay. Yeah, I just cannot blow dry non-shampooed wet hair. It's just I can't do it. Um so everybody's got their own little tips and tricks for their particular hair, but so there's a sweet spot for you, and if you wash your hair every single day or even every other day, there chances are good that if you give it some time, you can extend that out several
Hmm.
more days, but it does take time. So, what you want to do is train the oil glands to not produce so much oil so quickly. And I know Ashley has done some looking into specific types of brushes. So, talk about that.
Well, so talking about like your hair, your scalp wants to produce that natural oil and you don't want to
Yeah.
strip that, and it's a natural lubricant for your whole
Mm
strands,
hmm.
right?
Mm
So
hmm.
you want to pull that oil down the strand. And so I use a boar bristle brush pretty
Okay.
much whenever I'm home and I go to the bathroom, I'll brush
Mm
my
hmm.
hair with it. I make sure to brush my hair at night with it.
Mm.
um, yeah, I don't know if it was Rapunzel or what growing up, but
Yeah.
was it that movie that she like made sure she brushed her hair every night for like
Like a
40
100
strokes?
strokes?
Yes, 100
Yes.
strokes.
Yes. It must have been. That sounds right. I
Yeah.
wonder if it was.
So as a kid, I used to brush my hair like I'd count literally to
Oh,
however
wow.
what the number was. Um,
Oh, yeah.
I don't do that now, but
Yeah, I was gonna say, I
I do use
definitely
a
don't.
brush that just kind of naturally gently grabs
Mm,
the oils and pulls it down the strand.
mhm.
Um,
Yeah.
and
And that
it's just
probably
one extra thing.
yeah. And that probably helps to keep the part and the area right next to your scalp. It probably helps to keep the oil away from that because honestly, like, the ends of my hair, most of my hair could go a really long time without washing, but
Mm-hmm.
it's the scalp because that's where the oil comes from and you're not moving it down.
Yes, and it just feels disgusting. Like
Right.
it honestly, my hair, I don't know if yours gets like this, but it's like there's nothing to do with it. Like there's
Oh
no
yeah.
like right now I can kind of flick it and it kind of just
Mhm.
falls right back. Like In
Mhm.
a few days, it's going to have some buildup, and I need to like pull that down.
Yeah.
The other
Yeah.
thing too that I'm really trying to get better at is not using dry shampoo.
Yes. Yes. Although we love it.
I
We
know.
love dry shampoo. But I typically use cornstarch more than I use dry shampoo.
And I
Um
do like cornstarch more. It's just a little
mhm.
messier.
It is, yeah, but so we're talking about literally just using cornstarch from the grocery store. If you've
Mhm.
got dark hair, there isn't a great solution for this yet. I know that there are some
Mix in some
DIY.
cacao powder in it.
Well, no,
Yeah.
actually, no, for real. There are DIY solutions for people that want to use cornstarch that contain like cocoa powder, like
Hmm.
literally Nestle cocoa powder. And so just to make it darker, but it still will absorb oil and then not give you that like kind of whitish look, that the cornstarch does. But
Hmm.
I do like cornstarch. I take a big fluffy makeup brush that I use for cornstarch and I just dip it in, shake off the excess, and then just dab it along the root line, and then rub it and then brush it out.
There you
And
go.
it works extremely well. And then you're not getting all of the, there's a lot of environmental toxins associated with dry shampoo.
Yep.
And even though
Especially
it
in the aerosol
smells,
bottles.
yep, that's exactly right. And so, yeah, I much prefer to use cornstarch. But yeah, that's about the only dry shampoo that I will use.
Hmm.
Um, and then I want to talk a little bit about heatless curls because heat will also
Swing.
help break your hair.
Hmm.
It will make it brittle, and if again, I got a lot of hair and when I curl it, it's heavy and the curls don't last very long, and so I'll get maybe a day out of them, but so I'm faced with like applying a lot of heat to my hair every single day if I want it to look decent. So that's problematic. There are these heatless curl things now, and in fact, the next thing that I'm trying is, have you seen the videos where they use like a tube sock?
Hmm.
Okay, that's
I've
the
done
next
that.
thing that I'm doing. Have you? How did it work for you?
It was fine. I mean, it wasn't. Yeah, it was fine. My hair's just so
Okay.
thin and like I feel like yours would do better.
Okay. Well, I'll try it. I'll
Yeah.
try it. So
But do
I
you
have
have
a
like the big
Yeah,
pipe
I
thing?
do. I do. I have a robe curls and it works great except that it's super unwieldy to sleep in. Like I feel like when I lay my head to either side, I'm like kind of sleeping on this bar that's got my hair wrapped around it. I don't know. It's not super comfortable. But I think they have better designs now, and I'm gonna try the sock.
Yeah.
If you get on YouTube, look up look up heatless curl tutorial with tube socks, and it sounds nuts,
Yeah.
but those curls are better than what I can create with my curling iron, and they
Yep.
last a whole lot longer.
Hmm.
And you do it to dry hair. So
Yeah.
you don't need to worry about wetting your hair down or anything like that. It's just dry hair, wrap it around, follow the videos, and it's so much better for your hair than all
Yep.
that heat.
Yep.
Um Now, the final category, I want to go back to conventional medicine because
Hmm.
we've talked about these functional approaches, and Ashley and I much prefer the functional solutions for hair, obviously. But I do have patients that are on some medications for hair loss, and they do work. They do work. So, hair is a really emotional topic for a lot of women, and so sometimes we need a medication.
Hmm.
So let's talk about it. So the first one, and probably the most commonly used, is going to be something called minoxidil. Now, this is Rogaine, and a lot of people are familiar with this. So, they're interestingly, I know minoxidil from like probably 30-35 years ago. It used to be only in an oral formulation. It was a blood pressure pill. Okay. So minoxidil originally was the trade name was Lonitin, and it came in an oral tablet, and it was used to control blood pressure. Now we have much, much, much better blood pressure medications now, so it's not used for that any longer. But what they found is that people were getting weird hair growth with it. And so as a side effect. And so drug companies put it in a topical solution to see if it would do anything topically so that you didn't get the lowering of the pressure, because the last thing you want is to take a medication to grow your hair and then have it drop your pressure so you're walking around dizzy all the time.
Mm-hmm.
So there is a 2 and a 5% topical solution. You can also get a foam. Um, and yeah, there are lots of people that use this very successfully. And the problem with Rogaine or minoxidil, there are women formulations and there are men formulations. And the female formulations are a lot more expensive, is my understanding. So just
Oh.
get the men's. So just get the men's. You do not need to get the pink box or
And
whatever.
you don't need a prescription?
No, you do not. This is
Okay.
completely available over the counter. It used to be prescription, but you can get it like just at the grocery store now. Um, so Rogaine, yes, has been very successful. Now there is also a resurgence of oral minoxidil being used, and it's being used off label to treat both male and female pattern hair loss. So
Hmm.
I do have patients that I have sent in scripts for oral minoxidil for their hair loss, and it seems to work pretty well. So what it does is it increases that phase where you get hair growth in the follicle. We talked last time about the hair follicles going through phases where it will grow the hair, grow the hair, grow the hair, and then it will spit the hair out. And that is
Mm.
a normal phase for a follicle. But um as we age, or because of these things that cause hair loss, they can shorten the growing phase and increase the spitting out the hair phase. Okay.
Mm.
So what this does is it increases that anagen or growing phase, and also has the added benefit of thickening the hair, the actual hair itself. And so that makes it look like the hair is fuller, right?
Oh.
So you have to maintain use, or the hair will thin, the hair will fall out within just a few weeks of
Hmm.
you stopping using it. So it isn't something that is a permanent fix.
Yeah, so again, it's kind of like a band-aid.
Yeah, exactly. Exactly. Then there is something called propecia. So finasteride or propecia is primarily used in men. You don't want women of childbearing age to use this, because it can really cause problems if you're carrying a male child. And so that's why you'll see black box warnings on these medications that say, cannot tablets cannot even be handled by pregnant women. Okay. So it's problematic. But for a postmenopausal woman, then I have seen finasteride used. I don't write for it, but other people do. Um, and then finally, there is spironolactone. So if you've got, and we talked about this in the last episode, if you've got someone that has a female that is androgen dominant, she's got too much testosterone, and she's starting to get that male pattern hair loss, then if it's because of increased testosterone, you can give a medication like spironolactone, and that will block testosterone, and so then because of that, it will stop the hair loss that's being driven by the testosterone. And
Very
that
interesting.
yeah, that those are the primary medications that we have. There really isn't anything better um available right now. But yeah, I'm kind of excited about the peptide. I'm kind of excited about the GHK copper. I think that's got a future for hair loss. But honestly, you guys, there's so much low-hanging fruit with diet, with lifestyle, with just keeping your stress under control. And that really doesn't cost anything.
Yeah. And then just making sure that you're making sure that you're addressing your hormone balances
Mhm.
as well. Because
Mhm.
did we talk about thyroid? We talked about thyroid in the last episode,
Yes.
right? Yeah.
Yes. Yeah. And that's one of the key takeaways here is that when you go to your primary care, and one of your concerns is hair loss, you want to make sure that you're getting an accurate diagnosis. And you guys, honestly, sometimes there's no diagnosis to make, but you honestly want to make sure that uh, it that the proper labs are being ordered, right? Like somebody is taking a really good and thorough look at your thyroid, that they are taking a good and thorough look at your iron stores, your ferritin level, your hormones. Okay. So there's lots and lots. It's multifactorial when it comes to hair loss. So you want to cast a wide net.
Yes.
And sometimes all those labs will come back normal.
Yeah.
And so you have to say, okay, so now we got to go back to the drawing board and we're going to start with the basics here. We're going to,
Yeah.
how much protein are you eating? How much, what are you doing? What's your stress level like? How are you managing these things? What medications are you on? So,
Mm,
so it's a really, you want to give as much information as you can. And as a provider, you need to be collecting a lot of information to try and
mm,
figure this out.
absolutely. And if you don't know what kind of labs to get, we have several episodes
Mm-hmm.
in our original episode lineup on, well, the big one was our autoimmune series, but then we did
Mm-hmm.
an episode
Mm-hmm.
on, believe, specifically on thyroid.
Oh, I'm sure
Um
we did.
and
Yeah.
then we talked about there was one that was kind of labeled signs that you might be like a
Oh,
supplement
nutrient deficiencies
nutrient
and
deficiencies and stuff like that.
mhm.
So
Mhm.
go back to and listen to all of those to make sure that you have a good handle on what, even to maybe present to your primary
Yeah.
care.
Yeah, and you know what? I'll just rattle off the ones that I made a note of here, and you guys can take this down. But I would get a CBC, that's a complete blood count. I would get a comprehensive metabolic panel. I would get an iron panel, and that includes iron, transferrin. I would get a ferritin level. I would get a thyroid panel. So this would include a TSH, a T3 total, and a free and total T3, and then also a T4, free T4. And then I would also get a hormone panel drawn in your luteal phase. So this is going to be around day 20 of your menstrual cycle, but all of this needs to be chatted through with your primary care so that they can tailor it to your specific situation. But that'll at least give you the a handle on kind of what you can expect.
Yeah, absolutely.
Okay.
Well, this was very awesome and very insightful, and hopefully you found the information um, helpful in your hair journey, whether
Mm-hmm.
you're just trying to make your hair healthier as you age,
Mm-hmm.
or maybe you're dealing with some of these hair loss issues and needing to find some solutions um,
Yeah.
like these. So, let us know if you found these episodes helpful. That is always helpful to us because
Mm-hmm.
when we're coming up with topics that we want to address, sometimes, um, well, we always want them to be helpful to you. So let us know.
Mm-hmm.
We love hearing from you. And if you have any questions or maybe things that have helped you in your hair loss journey, we would love to hear from you as well. Our contact information is always in the show notes, and we will catch you on the next episode.
Bye.
Hi, guys. If you are still listening, you are listening to this recording after the fact of this episode that you just listened to. And we wanted to separate this because we had something exciting in the works that wasn't quite finalized when we recorded that episode. So we now have that all finalized and we can share it with you.
And so, as you know, we have ranted and raved about collagen for, for those of you that have known us for a while, it's been years and years. But for those of you who are podcast followers, you know that we love collagen. We talk about it. Oh gosh, we've mentioned it on, I can think of probably close to 10 episodes, if not more, because it's just it's hair, skin, nails, joints. What else are you gonna say? You also know that we don't make recommendations unless we really believe in something, and we don't take that lightly. So, because we don't mess around when it comes to quality, we just have an exciting opportunity for you.
Absolutely. And so Andrea recently discovered this brand called Yonder Collagen, and she immediately fell in love with it. They are a clean collagen and they are USA made formula. The
Hmm.
yeah, everything about it is USA.
Yeah, yeah, it's just a really, really a good formulation that I believe in. And we didn't want to bring this to you until, we had talked with these folks and know who they are and what they're about. And I'm happy to report that this is a great company. And so this is pasture raised, grass fed, no junk. You can get it in unflavored, vanilla, chocolate. I'm a purist. I get the unflavored. I add it
Same.
to my coffee in the morning. I think that's, yeah, Ashley, you add it to your coffee too.
I
Um,
do. And
yeah,
that was the
it's
other thing that we wanted. We wanted time to be able to actually use the
right.
product over the last several weeks to make sure that we liked it.
Yeah.
It was up to our standards, and it definitely
Hmm.
has hit all the check marks for us.
Yeah, for sure. That's a great point. Yeah, dissolvability, that's a huge one for me. And also like no strong taste. So I'll put
Hmm.
a scoop in each cup of coffee that I have. And that usually ends up being 2 to 3 scoops a day for me. And that's where I recommend people start, is with 3 scoops a day, and then you can kind of back off to two after about 60 days. So that's kind of where we've landed on this. So Yonder
Yeah.
Collagen.
Yes. So we were able to secure a nice little discount for our listeners. You
Hmm.
can get 15% off your first order and use the code AA15. That's all one word. Doesn't matter if it's I don't think it matters if it's capitalized or
Yeah,
lowercase.
I don't think it does.
But it's at yonderfoods.com. That's YONDERFOOD.com.
Yep,
And it's
and
double A 15.
yeah, so double A, all one word, DOUBLEA 15, and that will secure you 15% off your first time order. And it's not valid with any other orders, but we do think that you are going to love this as much as we do.
So happy collagen!
Bye. The content provided in the Double A podcast is intended for informational and educational purposes only. The podcast is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The information and opinions expressed in this podcast are solely those of the individuals involved and do not constitute medical advice.